Hey everyone, I'm Dr. Vlad, a pediatrician specializing in autism for children. Today, I want to talk about the only proven strategy to help autistic children improve the core challenges of autism, and that is applied behavioral analysis therapy, or ABA therapy. Children with autism often face unique learning challenges. Their brains process information differently, which impacts their behavior, communication, and social interactions. ABA steps in to provide targeted support. It's important to understand that there are different styles of ABA therapy. Some are more structured and some are less structured. And these different styles apply to help different children on the autism spectrum to learn best. First, let us start out with discrete trial training, or DTT. So in discrete trial training, you imagine breaking down a complex skill into smaller and more manageable steps. DTT does just that, and here's how it works. With applied behavioral analysis, you have the ABCs. You have the antecedent, the thing that happens before, the behavior, and the consequence, the thing that happens after. So we show a child a cue or an instruction like, say hello, Roger. Then the child responds, hopefully with a hello. And the consequence is, if the reward is correct, we reinforce it with positive feedback or with a reward. DTT is like teaching a puzzle piece by piece. It is structured, it is efficient, it is effective. It teaches small pieces to build up the larger picture. A less structured way of applying ABA therapy is something called pivotal response treatment. It focuses on pivotal behaviors like motivation and self-management. So you see a child who's having fun playing with a car and a ramp, and you ask them, is it a red car or a blue car? And then you give them the red car to roll down the ramp when they point to the red car correctly. Then you want to encourage natural interactions with play-based activities. Aside from those two types of ABA, there is also the Early Start Denver model, the ESDM. And that combines play-based activities like the pivotal response treatment with traditional ABA techniques like the DTT we mentioned before. And these are usually tailored to individual child needs. So it's also in a natural environment, but it teaches kids multiple skills at the same time. So while teaching colors, like with a toy car, you might also teach turn-taking and other social skills. This bridges the gap between structured learning and everyday life. Another form of ABA is called verbal behavior, that emphasizes the development of language. It teaches communication skills using ABA principles, and it targets functional language, such as requesting specific things, labeling items that they see, and conversations. Then is the natural language paradigm, which encourages spontaneous language use. It takes place in a child's natural setting, in their home, in the community, and it promotes communication without having a rigid prompt making the child speak. For parents in New York State, navigate autism with confidence. Call our office and empower your child's development with proven strategies and compassionate care. If you learned something from this video, please hit the like and subscribe buttons below and leave a comment to help spread the word. Imagine a world where every child with autism receives personalized support, where their progress is celebrated and their challenges are met with compassion. ABA understands that the child with autism is not ignoring you. They are simply waiting for you to enter into their world. And the way you approach them makes all the difference. With ABA, you are shaping that world one behavior at a time.